Sleep apnea is basically a sleep disorder where a person repeatedly stops and starts breathing during the night sleep. The most common form, obstructive sleep apnea or OSA, occurs when the airways become blocked, often by relaxed throat muscles at night or a structural issue within the nasal passageway, soft palate, or also the tongue base. Very common studies suggest that up to 25% of adults may have some form of sleep apnea, though many of them are undiagnosed. It's more prevalent in men and people who are overweight and those with anatomical dispositions such as a deviated nasal septum, enlarged tonsils, or a reclining tongue base may be more prone to suffer from sleep apnea. That's a great question. The most common symptoms include a loud habitual snoring, gasping or choking during the night sleep, daytime sleepiness or fatigue, morning headaches, for instance, difficulties concentrating at school or work, a dry mouth, for instance, or sore throat, open waking up. Often the sleeping partner recognizes the symptoms first and makes the patient aware of his problem. ENT doctors play a key role because many causes of sleep apnea are due to an anatomical reason. Our diagnostic approach usually involves a detailed history. That means we sit together with the patient and we ask about their sleep quality, how does snoring occur, daytime symptoms, any weight changes in the recent time, nasal congestions, and also the medical history that in the family seen before. Then usually a physical exam comes after. We examine the nose, the oral cavity, the tonsils, the tongue, the palate, and also the neck. After that, we look into the nasal cavities, into the nasal passageways with an endoscope. So we call this a nasal endoscopy, as well as looking further down into the throat to see if there's any potential obstruction. Absolutely. A sleep study is essential. Most patients are referred to the hospital to get a polysomnography done. This is an in-lab sleep test where they're staying overnight, or they do a home-based sleep study, like a screening test, where they get a custom-fitted device and they take it home. These monitors the breathing patterns, the oxygen level at night sleep, the heart rate, sleep stages, various snoring episodes, and also the limb movement. The apnea-hypopnea index measures how many apneas, that means complete stoppages of breathing, and hypopneas, that means partial blockages, occur per hour of sleep. And usually we say if you have a ratio between 5 and 15, we say it's a mild sleep apnea. If you have between 15 and 30 episodes, it's a moderate one, and everything above 30 is a severe sleep apnea. Everything below 5 is supposed to be normal. This is very important for us because it helps us to tailor treatment. Yes, if I suspect any anatomical issues beyond what we can see directly, like any complex upper airways obstructions within the sinus system, we may order a CT scan of the sinuses or a cephalometric, that means a side view X-ray for jaw alignment. And we also have the option to do a drug-induced sleep endoscopy, which means we give a medication which puts the patient immediately to sleep, and we are measuring any potential obstructions in the upper airways, which is very essential and helpful for the diagnosis. ENT specialists can offer both surgical and non-surgical solution for the problem. We often correct the structural cause like nasal obstruction, enlarged tonsils, or tongue-based hypertrophy. We also refer patients for a CPAP mask adjustment if this is the treatment of choice, if they're more qualifying for a conservative treatment approach. I would say don't ignore snoring or excessive fatigue. Don't ignore snoring or excessive fatigue. Sleep apnea is more than just a nuisance. It's linked to high blood pressure, to potential heart disease, to diabetes, or even stroke at a later stage. I would recommend see a provider early. Listen to your sleep partner if they recognize you are not sleeping well, you're snoring, or you have this gasping for air events at night. It can be serious. A simple evaluation, which does not hurt, can dramatically improve your health and quality of life, and most important, prevent further disease from developing in the future.